All right, today I'm going to be performing the bedside assessment for my patient. Before entering the room, I'm going to check for any isolation or precautions or fall risks like airborne, droplet, contact. Um, Enter the room, knock knock. Hello, my name is Brandon. I'm going to be taking care of you today, all right? I'm the student nurse.
Okay, hello.
All right. Do hand hygiene before interacting with the patient. Just going to check your wristband real quick, okay?
Okay.
And what's your name and date of birth?
Maria Madala, 52880.
All right. Her response corresponds to what's on the band, so I know I have the right patient. Before starting, I'm going to just make sure that there's no hazards that I need to take care of right away. Any issues with her oxygen, if she's on oxygen, or anything laying around on the floor. Can you tell me, are you in any pain right now? On a scale of 0 to 10, 0 being no pain, 10 being worst pain you ever felt in your life?
No pain, 0.
All right, patient responds with 0 pain on a verbal numeric scale, indicating that she's not in pain. Next, we're going to go to the general appearance, just inspect and observe for any abnormalities. Her facial expression is calm and relaxed. Her mood and affect is appropriate for the situation. She's laying supine in bed. Head of the bed is about 30 degrees semi-Fowlers. Patient is alert. She's been responding to my questions. Skin color appears to be normal. No issues noted with her skin, and no skin color that indicates she's in any distress. Next, look over the personal hygiene. Hygiene seems to be good. She's well groomed. Her appearance is kept together. Her speech, the conversation we've had so far, speech is clear, articulate, and fluid. She's easily understood. Her hearing is appropriate. She's able to respond to my questions without prompting too many times. Now I'm going to ask you how you've been eating in the last 24 hours. Can you tell me what you had for lunch and dinner yesterday and then breakfast today?
Okay, I've been eating good. I had a chicken sandwich for lunch. For dinner, I had a beef stew and rice and a salad. And this morning, I had an egg sandwich, a banana, and some coffee.
All right, patient's nutritional status is very good. Her meals are well balanced and include a wide range of proteins, fats, carbohydrates, everything that she needs. Next, we'll move on to the neurological assessment. At this point, I'm going to ask the patient and assess their orientation. Can you tell me, do you know where you are today?
Yes, I'm at John Tyler Hospital.
And do you know what today is, the date and the day of the week?
It's Monday, the 1st of December.
All right, patient is alert and oriented times 3. Her verbal responses are appropriate. Communication, her responses are realistic and appropriate for the situation. Now I'm going to check her pupil response to light. Can you look at me? I'm going to shine this light in your eyes. I'm just going to make sure that you're reacting to the light appropriately, okay? All right, pupils are equal and reactive to light. Her pupils are round and respond briskly. Size of the pupils are 2 millimeters bilaterally. Next, I'm going to give you this cup of water. Just make sure that you're not having any issues swallowing, okay? Patient demonstrated ability to swallow. She has no issues swallowing at this time. Next, I'm going to check her muscular strength, make sure that her upper extremities and lower extremity strength is normal with no deficits. Can you squeeze my fingers? Can you push my hands? Pull my hands? Can you pull up on my hands with your feet? Push down. All right, her muscle strength is +5 in both the upper extremity and the lower extremity. No deficits noted at this time. Next, I'm going to move on to the cardiovascular assessment. Actually, I'll do the respiratory assessment first, since I have the patient posterior, laying down, and I'll get them to sit up. As I noted earlier, the patient's not on any oxygen, but if the patient was on oxygen, I would check the wall setting, make sure that the patient's oxygen level is what the orders say they're supposed to be. Patient has no respiratory distress, non-labored breathing, no accessory muscles are being used. I would also check the mask fitting, make sure the mask or the nasal cannula is fitting appropriately, and that there's no skin breakdown or irritation where the mask meets the face. Now I'm going to listen to the breath sounds. I'm going to listen to your breath sounds on the front and the back. Okay, I'm going to start with the front.
Okay.
Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. And one more time. Alright. Are you okay to sit up for me?
Sure.
At this time I'm going to listen to the posterior of the patient as well, just to check breath sounds. Make sure that they match with what I heard on the front. Alright, deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Alright, you can lay back down now. Lung sounds are clear to auscultation bilaterally. No abnormalities, no stridor, wheezing, crackles heard. Full breath sounds heard, all from the base to the top of the lungs. Next, I'm going to move to the cardiovascular. Actually, before moving to the heart sounds, I'm just going to ask the patient, can you cough for me? Take a deep breath and cough. And did you feel like you produced any mucus?
No.
Our patient produced no mucus, but if the patient did, I would check for color, consistency, see if there's any odor, and if the patient also had an incentive spirometer at the time, I would make sure that the patient could show me that they're able to use it appropriately, and I would educate as needed. Next, I'm going to move on to the cardiovascular assessment. First, I'll check the apical pulse. Apical pulse is regular, then I'll compare that at the same time to a radial pulse. The apical and the radial pulse at this time are equal. Radial pulses are +2, check bilaterally. Radial pulses +2 strong and equal bilaterally. Next, I'll listen to the heart sounds. Both with the diaphragm and the bell. Start with the bell first, or the diaphragm first. Check the aortic, pulmonic, tricuspid, mitral, and check with the bell, aortic, pulmonic, tricuspid, mitral. Normal S1, S2 heart sounds noted, no abnormalities, no murmurs noted at this time for the patient. Check the cap refill. Patient's capillary refill is less than 3 seconds, and I'll also check capillary refill for the lower extremities and the toes. Also less than 3 seconds. Check the pedal pulse. Pedal pulse is present and strong, +2. I'll check the posterior tibial pulse. That is also present. Pedal and posterior tibial pulses are present, strong +2 bilaterally and equal. I'll check the pretibial edema. Note that no edema is noted at this time. While I have the legs exposed, I'm just going to check for any lesions. See no lesions, no dressings, no drains at the moment. Skin is warm to touch. Skin color is appropriate for ethnicity, and the turgor is appropriate. Skin is intact with no signs of breakdown. The patient was on the IV. I would check her IV site, and then I would also check the machine to make sure the fluid rate is what's being ordered for her. Check the IV site to see if there's any pain, any signs of infection. Here I'll move down to the abdomen. Now I'm going to walk over here and lower the bed flat so I can get a better assessment on the abdomen. You comfortable?
Yes.
Alright. First I'll inspect the abdomen. Abdomen contour is flat. See no bumps, no lesions, no drains at the moment, no dressings. Just feel the skin briefly. Make sure that the skin temperature is appropriate. It's warm and dry. Skin color is appropriate. Hair distribution is appropriate for age, gender, and ethnicity. Next, I'm going to go ahead and listen to all 4 quadrants for breath or for bowel sounds. Start with the right lower quadrant. Move around clockwise. Alright, bowel sounds are active, present in all 4 quadrants. Next, I'm going to go ahead and lightly palpate your abdomen for you. Can you please tell me if you have any pain or any tenderness? Alright, I'm going to palpate each quadrant individually. Assess the patient's facial expression, see if there's any guarding or any signs of distress. And assess the bladder for any distension. You have any tenderness?
No.
Alright, patient reported no pain, no tenderness. Abdomen is soft, non-tender on palpation. Have you had bowel movement recently?
Yes.
And
This morning.
This morning?
Mhm.
Was it normal consistency, color?
Yes, everything was fine.
Alright. And have you had any issues passing gas?
No.
No issues passing gas. And have you had any, eaten anything recently that's caused you any nausea, any vomiting, anything that you found you can't eat?
No.
Alright, I'm gonna raise your head back up, okay?
Okay.
Comfortable?
Yes.
Alright. Well, next I'm gonna ask about your voiding. Have you had any issues urinating recently?
No.
And can you tell me the last time you were able to go to the bathroom and urinate?
This morning.
Did you have any issues? Any
Mm.
blood, any pain, difficulty?
No.
Alright, no pain.
No.
And can you tell me, do you remember what the color and the clarity was?
It was clear yellow and usual amount.
Usual amount?
Mm-hmm.
Okay. Any odor?
No.
No odor. Alright. Alright, from here I'm just going to move on to activity. Make sure that the patient, I noted her health history and her chart said that she was not on bed rest. At this time I'll ask the patient if she wants to ambulate to the chair or if she's comfortable in bed. Do you want to move to the chair or do you want to stay in bed?
No, I'll stay right here.
Alright, since the patient said that she wants to stay in bed, if she had wanted to get up, I would take that time to observe if she had any difficulty ambulating or if she had, if she needed any extra assistance as far as ambulating. Since she does want to stay in bed, check the bed position, make sure the bed position is appropriate, make sure the head of the bed level is appropriate as well for the patient, and make sure that they're comfortable. On inspection, the patient seems to be comfortable, no distress. I note that the patient doesn't have any SCDs, no TEDs, no foot pumps, so that doesn't add to her risk for fall. Her chart says that she can tolerate activity. She's mobile. Her nutritional status is okay. I don't see any ambulation assist device in the room. So at this time, I would note that she's not a fall risk. Prior to leaving the room, I'll just make sure that the room is free of clutter, IVs on the same side, so that she doesn't have to cross over for her IV, and she has a clear path to the bathroom. I bring the tray close to the bed, make sure she has everything that she needs before exiting the room. I'll lower the head of the bed, or lower the bed to its lowest position. Make sure the brakes are locked, which they are. Return the side rails back up ×2 to provide the patient with safety, but not restraining the patient in any way. Head of the bed is okay. I make sure that the bed controls were within reach. Call button was within reach before leaving the room. Do you have any questions before I leave?
No, I'm good.
And are you comfortable?
Yes, thank you.
All right, and at this time I would exit the room and document my findings. Did I forget anything?